The majority of chlamydia infections are asymptomatic. That means that most people with chlamydia that's affecting the urogenital tract, it's an STD, sexually transmitted disease, do not have symptoms. So if you're waiting for symptoms to tell you something is wrong, you're not going about this the right way. Now, I'm going to tell you what the symptoms are if you get symptoms. But remember that most people do not get them, or at least many people don't. Let's start with women. In women who do get symptoms, okay, it can cause, say, an abnormal vaginal discharge. It can cause like burning or discomfort when you're peeing. And sometimes there are other symptoms as well. Now, when we talk about men, men, again, don't often get symptoms, but if a man gets symptoms, the symptoms might be a penile discharge. And if you have penile discharge, oftentimes it may not be that much. You just wake up and you see a little bit of discharge in your underwear, as an example. Some men will get burning when they pee. Also, some men may get pain and swelling in one or both testicles, but this is less common. Now, there's also other symptoms you can get from the urogenital tract infection of chlamydia, okay? You can actually get rectal infections. Both men and women can get chlamydia in the rectum, right? This happens either by having anal sex or, spread from another site. The chlamydia spreads from the vagina, etc. Again, these rectal infections may not cause symptoms, but if you do have symptoms, you may have rectal pain. You may also have discharge. And let me also say, it's not just the urogenital tract that can be affected with chlamydia. You can actually also get eye infections, okay? So chlamydia, if somebody's genital secretions gets in your eye and they have chlamydia, you can actually get a chlamydia infection of the eye. You can also get a chlamydia infection of the throat as well. There are other types of chlamydia infections and other infections. Whether you have symptoms or not, you need to get treated for chlamydia and any other STD. The reason why is because, especially in women, if chlamydia goes on without treatment, it can actually cause permanent damage to a woman's reproductive system. What that means is it may become harder for a woman to get pregnant. She may not be able to get pregnant. She might be infertile or may have or experience pregnancy loss, okay? And also keep in mind that if you do get symptoms, they may not occur at the time of your infection, okay? They may not occur until weeks after having sexual experiences with the person who you got it from. So understand, it's a little dicey in terms of being able to pinpoint what's going on. So now let's talk about how you get chlamydia. First of all, I want you to take a look at what it looks like under the microscope. This is chlamydia. It's a bacteria. How do you get chlamydia? Well, you can get it from having vaginal, anal, or oral sex without a condom with someone who has the infection. But that's not all, because pregnant women with chlamydia can give the infection to her baby during childbirth. Also, you can get chlamydia without having sex. What do I mean by that? Let's say you share sex toys with someone or other people who have chlamydia. If you share sex toys with someone who is infected, you could then become infected. A few notes about how you do not get chlamydia. You're not going to get chlamydia from sharing food or drinks, from hugging or holding hands. You're not going to get chlamydia from using a toilet after someone else. People say, "Oh, I got it from a toilet seat." Not likely. I have a video on that, by the way. You're not going to get it from like inhaling droplets if somebody coughs or sneezes and things like that. So how are you going to keep from getting chlamydia? First thing I say is to be judicious about your sexual partners. Minimize your sex partners and have open and honest conversations with your sex partners about basically where you've been, who you've been with, what you've had in the past, if you've ever had anything, how often you get tested, all that kind of stuff. Being open and honest is going to be very important, but also minimizing the sex partners, I gotta say that again, very important as well. The other thing is safe sex. Use a condom. Use it the right way every single time. I have a video on how to use a condom properly. That's very important. The other thing is make sure you are getting tested. Some people are going to be higher risk for STDs than other people. Remember that in general, getting an STD or having an STD may make it more likely for you to get other STDs. You want to get tested. Oh, and gosh, I can't even believe how I didn't say this before. How do you test for chlamydia? Well, the good thing is it's pretty easy. Your doctor will either run a urine test or may do a swab, either like a cervix, a swab of your cervix if you're a woman, maybe a urethral swab. But generally, the urine test is pretty easy peasy. We can do rectal swabs as well, okay? And there is treatment for chlamydia. So I don't want you to worry. You can absolutely be treated by antibiotics. That is generally not a problem. Make sure you are getting screened for STDs and make sure you're getting treated right away and inform any of your sex partners if you've tested positive for anything. There are plenty of other ways to be safe and other things about chlamydia. This was just a small snapshot. I just wanted to jump in and give you some information. Check out my other videos on some other STDs, gonorrhea, syphilis, HPV, etc. Guys, I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. I do daily videos. Please subscribe to my channel on YouTube. Please like and follow my page on Facebook. I'm on TikTok, Instagram, LinkedIn, WhatsApp, Threads, you name it. Follow me there, and also sign up for my free health newsletter at drjencaudle.com.